Okay, so I wanted to do a quick video update of kind of where I'm at, what I've been doing, what I've been up to, and kind of my progress. I know a lot of people know that I've been dealing with some personal stuff. And also because I feel like I kind of owe at least a little bit of an explanation, especially to close friends and family members, curious people, just my Facebook friends. I know I've posted some things on Facebook, and so people have reached out and checked on me a lot, and just kind of asked how I was doing, am I doing okay, and things like that. And so I'm an open book. I'm willing to talk about my stuff with pretty much anybody. And also not only just Facebook friends and family and things like that, but also if my story helps anybody, that's a win-win for me, because if anybody's going through similar stuff to what I was going through, maybe hearing my story, and how I've gotten help and how I've changed and progressed even just in a couple of weeks, maybe it'll push someone else in the right direction if they're struggling with a similar situation in their life. So for a while now, I've been a little bit different, and I'm sure my close friends and family have realized I've been very, very reclusive, and I just haven't been normal Joni. I'm usually kind of the center of attention, and I'm loud, and I'm a super crazy extrovert, and I'm fun, and I'm spontaneous, and things like that. And for a good while now, I've just been different. I've just been very reserved, and I just feel like I've been kind of zombie-like, not really had much personality. I don't joke around near as much as I used to. I'm a lot more quiet. And, you know, friends would reach out to me and want to do this or want to go here. Or, hey, let's get together. Oh, yeah, okay. And I wouldn't follow through. I didn't have any real interest in getting together with really anybody. And so, like I said, I kind of feel like I owe an explanation to some people, just because I have been different, and, you know, there's a reason why. But for the longest time, it's almost like I was kind of in denial. I was just like, you know, I realize that I'm acting different, but I'm getting older. I turned 30 in a few days. Not something I want to talk about. But I just kind of thought, you know, it's just part of getting older, and people are just going to have to accept the fact that as people get older, people change. And I just thought, you know, well, I'm changing, and I'm a mom now, and I am getting older, and I don't always have to have some sort of sarcastic comeback to everything. And I don't always have to focus on making everybody laugh and being the center of attention and things like that. And so I just kind of, it is what it is. And I just thought, I'm just different. I'm just different now, and I'm transforming into a different woman, and it is what it is, and people are just going to have to get used to it. And so for a while, even though I had noticed that I was different, that was just my answer. It is what it is. And then I started having panic attacks. And if you've never had a panic attack, I'll do my best to try to explain it. But shout out to anyone that has had a panic attack. It is the scariest thing in the world. I mean, it's terrifying. And I was having horrible panic attacks, and nothing was provoking it. I mean, sometimes I wouldn't even be anywhere. I would be at home sitting there watching probably Judge Judy, to be honest with you. Like, literally nothing would be provoking me, and my heart would start racing, and I would feel like I'm choking. I can't get enough air. I'm having an asthma attack. My heart's racing. It's the scariest feeling. And I kept having these feelings like fight or flight. When, you know, think of somebody's chasing you with a chainsaw, and you need to do something. You need to figure out, you either need to run somewhere and get away from them, or you need to fight back, or you need to do something about it. But something extreme is happening, and you need to figure out what you want to do to get out of the situation. And I was having those feelings literally doing nothing. I was sitting at home in my living room watching TV, and that would happen. And I would like pop up, and like, it's like, I need to go. I don't know where I need to go, and I don't know what I need to do, but I need to do something. And it was horrible, and it was terrifying. And then it got to where I was throwing up during the panic attacks, and I was sweating, and I mean, it's the scariest feeling. And my gut instinct is I want to go to the ER, because I want people to be able to tell me that I'm okay. My husband consoling me, or my mom consoling me, or my family members or friends or whatever, that's not enough for me. I am the type, and I've always been like this, which is kind of a good thing. When I'm sick or when something's wrong, I want to go to a professional that can tell me, am I okay? Is something very serious happening? Which is a good thing, and it's a bad thing, because then that turned into my defense mechanism. So, as a lot of you know, I had left my employer of 10 years, and I got a new job. And I was there about 3 months. And just to give you kind of a perspective, so in 3 months time span, I went to the ER 4 times in 3 months. And every single time they told me it was a panic attack. But in my head, something very serious was happening. Something was wrong, and I needed to know what it was. Every time I thought I was having a heart attack, my arm would go numb. The chest pain was just surreal. And I got an app on my phone, which that's a whole nother story, but it would tell me my pulse. And sometimes my pulse would literally get up in like the 140s, 150s. And that's terrifying. When you're not doing anything to provoke your body to react like that, you're not working out, you're not doing any kind of strenuous activity, you're not exerting your body at all, and your heart rate gets that high, it's terrifying. Absolutely terrifying. And so my defense mechanism became to go to the ER every single time. Well, for starters, that's not good financially, obviously. But besides that, there's other people that are more serious that need the help of those doctors and nurses. And I'm taking their time up because I'm having panic attacks, and they keep telling me I'm having panic attacks. And yet I would go back over and over and over again. And so long story long, the panic attacks got to where they were just too much. And so once again, it's like I was in denial, and I chalked it up to I had started a new job. I don't do well with change. I can remember when we built our house a few years ago, we literally switched TV providers. We switched from I think it's DirecTV or something like that. Or no, we switched from Dish Network to DirecTV. And I lost my mind, you guys. I'm not kidding you. I was just like full-fledged meltdown. I was like, but the channels are different, and changing the channels different, and the guide's different, and the response time is slower, and ridiculous. Just because we switched TV providers. And I've always been like that. I don't do well with change. I just don't. I don't like change. I'm very habitual. I like routines. I don't like change. So once again, I chalked it up to why I started this new job, and I think maybe the commute's getting to me, the change is getting to me, and I don't do well with change. And I missed my old job. I didn't want to admit it, but day one of my new job, I missed my old job, and I missed the people there. I mean, I'd been there 10 years. My coworkers weren't just my coworkers. They're my best friends. They're my family members. I'm with them more than I'm with my real family. And so I missed it. And so long story long, and I won't get into details, but thankfully, some things had happened at my old job and that allowed me to go back. So some changes had happened while I was gone, and they had some room for me, and I reached out, and it just so happened they needed someone for a specific position and things like that. And so thank God it worked out, and I'm back. And so I started, and I'm thinking, everything's going to go back to normal. I'm going to be old Joni again, because it just so happened that all this stuff kind of aligned. That's when I started noticing that I was different. Is about the time that I was kind of searching for a new job and interviewing and things like that. And, Nathan and I went back to college last year and graduated at the same time. And so a bunch of things had changed in a really short amount of time. And I was just like, it's just the change. Change is what's triggering all of this. And I need to go back to my old job, and everything's going to go back to normal kind of magically. So I went back to my old job, and I'm still there, and I love it. I absolutely love it. I'm so happy to be back, and I'm literally going to be there forever. So if you know where I work, you know where to find me. I'm back, and I'm always going to be there. But things weren't changing, and I was acting okay, but I wasn't okay. I was literally faking it, and I don't know exactly how to explain it, but I was literally waking up every morning, my heart was just pounding out of my chest. I would wake up and just be so scared, and I don't know why. And then I would just muddle through the work day. And again, I was not myself. I was not interacting with my coworkers and friends and customers and things like that like I normally would. I was just there. But I wasn't Joni. I was very zombie-like. And it's because I was so scared all the time. I wasn't even in my right state of mind. And so I was faking it. I was absolutely faking it. The panic attacks had gotten to where they were lasting longer. I was waking up super scared and anxious and nervous. And at first it was lasting 30 and 45 minutes into my day. And then by the time I got up, got dressed, got Kennedy ready, got off to work, it would, calm down a little. And then it got to where it was lasting like an hour and 2 hours into my workday. And then it was practically all day long. And so again, I was faking it. Everything's fine and Joni's fine and I'm fine and I'm going to get through this. And I wasn't getting any better. I was just acting like I was. And so I had some medication that was like my emergency, like when I am having a panic attack, you know, the rare instances. I've had anxiety my entire life. And so the doctor had prescribed me some medicine, and I had to literally take it round the clock. I mean, right when I woke up, I had to take it. 4 to 6 hours later, when it wore off, I had to take it. And then 4 to 6 hours after that, I had to take it. I was literally relying on this medicine just to get me through the day. And even taking it, I wasn't normal me. I was just calm enough to make it through the day, make it from work back to home. And I still was not doing anything with friends. I wasn't interested in family get-togethers. I just wasn't myself. And so, once again, I just kind of brushed it off, thought I would be fine. Everything's fine. If not, I'm just going to fake it till I make it, right? And then the anxiety turned into depression. I've never dealt with depression, ever. And that's one of the things is anytime that I would go to the doctor about my anxiety or follow-up appointments over the years, I made it very clear to the doctor that I don't want any kind of antidepressant. I don't struggle with depression. I'm anxious and I'm nervous and I have these panic attacks, but I'm not depressed. I've never struggled with depression. And so for someone not to have ever dealt with depression, I think it took me longer to clue in that that's kind of where this was headed. But it got very severe very quickly. I had gotten to where I couldn't get out of bed at all. There were several days that I literally didn't get out of bed other than to use the restroom, and I didn't have to do that at all, barely, because I wasn't eating or drinking. And it got very, very bad very quickly. I wasn't taking care of my household. I was sending Kennedy off with family members, my mother-in-law, my aunt, my sister, my mom, all these different people. I was relying on them to kind of step in and help with Kennedy because I physically didn't have the energy or really the strength. My body was quickly declining. I was down to 97 and some change. I can't remember, 97 pounds, 97.8 or something like that. And to see those transformations happening in your body and you feel like it's just out of your control, it's scary, because what happens when you don't eat and you don't drink and you don't sleep? You know, at nighttime, I was spending all night on Googling symptoms and things that I was feeling mentally and physically. You know, what could this be? What could this be? And trying to kind of self-help myself, which really was just sending me into a panic spiral on the depths of the internet soul. So I wasn't eating, I wasn't drinking, I wasn't sleeping. And to see my body basically just deteriorating, and I couldn't stop it. I didn't have an appetite. It was taking me all day long to choke down a 6-ounce Gatorade. And I was drinking Gatorade simply because it's got these electrolytes. And, instead of water, I can drink this and it gives me this. It was just so silly, and it was exhausting. I was literally doing things that I thought were just going to keep me alive, keep the ship afloat for a little bit longer, and hopefully I'll get through this. And I wasn't. I wasn't getting better. I was progressively getting worse. My body was starting to physically shut down. Even blood work showed that. And the scale showed it. I mean, I was stepping on the scale every day, and the number was getting smaller and smaller and smaller, and I could see my body transforming. I remember waking Nathan up in the middle of the night, multiple nights, and saying, "Do you think I'm going to die? Tell me the truth. Do you think that I'm going to make it through this?" And him and my family and everyone were super supportive. You know, of course you're going to make it through it. We'll get through this. You need to get help and things like that, and just words of encouragement. But at the time, I didn't believe any of that. I didn't think I was going to make it through it. I really didn't. I thought Kennedy was going to have to tell me goodbye in a hospital bed, and it was going to be because my body was going to shut down. That's how my life was going to end. And the depression came from the fact that I had gotten to where I was never suicidal. Thank God it had never gotten to that point. It was never a thought of harming myself or anything like that. But I was giving up. I was just like, I surrender, white flag, I'm done, because I can't live like this. I can't live every day physically scared, terrified, relying on this medicine to get me through, hours at a time, then pop another one, hours at a time, pop another one. I'm relying on this medicine like clockwork just to get me through the day, to muddle through the day. And then I'm drinking these Ensure drinks and these Boost drinks that are taking me 4 hours to choke down a little 8-ounce drink to keep me alive. And I had gotten to where I was just like, I can't do this. I'm not going to do this. I'm not going to live like this. And if it is what it is, I guess I'm just going to die like this. And that's when I hit rock bottom, is when I was like, who is this? This is not how I think. This is not me. And I realized that it had progressed really, really quickly. And so I went to a consultation at a place, and I won't mention the name of the place. If anybody's interested, you can private message me. But I went to a consultation, and so they agreed it was bad enough that I needed help. I needed professional help. And long story long, they had given me a start date, and it was a few days out from my consultation. I went to my consultation on a Friday morning, and I was supposed to start the following Thursday. And I had a horrible weekend, all weekend long. I kept talking myself out of, Joni, this is ridiculous. You don't need this. You know, you can get through this on your own. I went back and forth. Again, didn't eat, didn't sleep, didn't drink. And I had such a horrible weekend that Tuesday morning, so 2 days before I was actually supposed to start, I got up at the crack of dawn. I drove to the hospital and literally told them, I know I'm supposed to start on Thursday, but I need to start today. I need help. I don't know if I'm going to make it to Thursday. I need help, and I need it right now. And thank God they let me start the program. And so I'm there every day, Monday through Friday. It's an all-day program. They have a mixture of group therapy, one-on-one therapy. There's doctors and nurses on staff that do medicine management, and so they're constantly doing blood levels and urine analysis and making sure that my medications are working, making sure the dosage is appropriate, checking in with me on the side effects and things like that. That was one of the things I struggled with. I would go to doctors and reach out for help, and then they would prescribe me something, and I was too scared to take it. You know, I'm reaching out to them because I'm anxious, and then they're giving me medicine that makes me anxious even to think about taking. And so this place has been perfect because there's unlimited doctors and nurses on staff that, worst case scenario, God forbid, if something were to happen, they're right there. Medical staff is right down the hallway from me at any given time. I'm getting a lot of one-on-one interaction with therapists that teach me how to cope with this anxiety and how to take care of myself and realize how important self-care is. And if there's one thing that I am taking away from this, holy cow, you guys, I can't take care of a little person and a husband and a household if I'm not taking care of myself first. And I wasn't. I had let myself go way too long, and it got way too severe for anything that I could manage on my own. I needed medication. The doctors kept telling me that and prescribing it to me, and I wasn't taking it. And it's okay to need medicine. I don't know why there's such a stigma of people needing any kind of anxiety or depression or any kind of medicine like that, because when people have diabetes or they have heart issues or they have any kind of serious ailment like that, it's no big deal that they have to take a pill, even if it's every day for the rest of their life. If it helps them and it helps their body function like it's supposed to, it's not a big deal. And mine was never a stigma about taking a medication for the rest of my life. Mine was, I'm terrified of the side effects. So again, being at a hospital facility daily, all day long, and knowing that if I do need to try something new, or if I need to increase my dosage, being able to just kind of take a short hiatus from everyday life and just taking care of me and putting the focus on getting me better so that I can be normal Joni again. It's been amazing. And I know everybody's not in that situation. Everybody can't take a 6 to 8 week hiatus from work. Thank God my employer has policies in place that deal with this kind of thing. But even if it's just finding a therapist or taking that step, going to your PCP, your primary care physician, and getting a medication or reaching out for help in any way, you have to check in with yourself, and if you are feeling bad, do something about it. If you're not yourself, do something about it. If you need me time, do that. Do whatever you have to check in with yourself and to take care of yourself. And so this is basically a 20-minute video, hopefully just to kind of push someone in the right direction, but also just to let everybody know that I'm okay. I know a lot of people were really worried about me. and I appreciate it so much. I have the best support system, all my family and friends. I'm doing so much better. I've gained 6.5 pounds and counting. And I'm hoping you guys can tell I'm starting to look more and more like normal Joni. If you saw me anytime in the last couple weeks, holy cow, I'm sorry. Yeah, because your girl was a wreck, okay? Like I for one thing, I looked like a walking skeleton. I hardly wore makeup at all. I didn't fix my hair. Who knows if I had showered? Probably not. So I'm sorry if you ran into me anywhere. And not only that, I haven't had a lot to say. I've been very zombie-like. And some of it was me adjusting to my medicine, but a lot of it too was me being in denial about how severe it had gotten and the help that I really needed. So just checking in. I am doing well. I'm getting better every single day. And I'm hoping to be back into my normal routine very, very soon. I love you guys all so much.